Hi, this is Dr. Kang's Scuba Diving Stories. Today's issue is about diving after coronary artery stent insertion. Very recently, a friend of mine, a fellow diving instructor, gave me a question on a social network service asking on this issue. And I thought this is a very serious question, and I explained something, but I thought maybe we need some social answer for this, for a lot of people who have done the stent insertion or a bypass surgery, or still have the symptom like angina pectoris, even myocardial infarction. So let me just briefly cover what is the disease that needs stent insertion. Oops. Okay, this is the heart, and these are branches of coronary artery. These are called the coronary artery because from the top they come down around the heart and looks like a crown. So when a part of the artery is narrowed, we put something like this. It's called angioscope, and then we put something in there which kind of push the internal wall of the artery, which looks like this. And here, this is the mesh that push the narrowed part of the artery, and then we remove the balloon out, so it remains widened this way. There are several different types of ischemic heart disease, and the key point is 1/3 of diving death is directly related to heart disease. So when we have heart disease, like many people do have, we have to take care of the situation as soon as possible. So we have arteriosclerosis, angina, acute coronary syndrome, myocardial infarction, and we look briefly over bypass and the stent insertion surgery. What is arteriosclerosis? It's narrowing and hardening of arteries. Narrowing of inner wall with cholesterol and other fat. So the wall itself also thickens due to the irritation of the cholesterol. So this eventually moves to angina pectoris and possibly to myocardial infarction, which is a real serious situation for all of us. Angina pectoris, this is a ischemic change of heart muscles. So when we have it, angina pectoris means pain of the chest. So we have pain on the chest, and then it goes to shoulder, arm, neck, jaws, and it's called radiating pain. We feel nausea, fatigue, we can't breathe well, sweating, and dizzy. So these are the symptoms of angina pectoris, and when you have this, if you have the symptom, absolutely you should not dive. This can lead to acute coronary syndrome and or myocardial infarction. So when you have the symptoms, you could probably rely on nitroglycerin. This is a sublingual medication which widens the inner diameter of the artery, so you can have brief symptom relief, but you have to do some surgical intervention. When angina gets worse and worse, then comes excuse me, acute coronary syndrome. This is somewhere between angina and myocardial infarction. So this is also where you can never dive. If you have any symptoms after angina pectoris, you should have the surgical intervention ASAP. So there's no diving, no way. And then comes myocardial infarction. Soon cardiac arrest, heart failure will follow. So this is a very emergent situation, both for patient and for hospital emergency room as well. So when we have a myocardial infarction patient, we do some emergency procedure for them. So what we do is we do some we remove the narrowed part of the artery and replace it with some removable veins. It's called bypass arterial graft, or we do a stent insertion. If we do the graft or stent, how many? It's one of the decision factor for post-stent or graft scuba diving. We also have to consider the surgical failure. We do the stent, we widen the inner diameter of the artery, but in one ear, 3 to 4% narrows again, which means it was a kind of failure. So if we have the disease and if we did go through some procedure, when or if ever can I dive? So we have to consider several factors. Depends on how bad your symptoms were. Depends on how well your heart muscles regain the oxygen supply and regain the power to beat. So these are something we have to decide at some point or in many points after the surgery. Single stent, for example, single stent with a short narrowed part. Some doctors even say probably he or she can dive immediately after. Like you go home, you usually do the stent and you go home in about 3 days. And one doctor said 1 month should be enough. He even said if it was himself, he would dive after about a week. I don't know. It sounds very philosophical. He said he cannot live without diving. So, but the bottom line, one stent, 1 month, if everything is okay after surgery. So before we really go for diving, we have to check ourselves first. By angiography, by EKG, we do some exercise test. So make sure we have to check thoroughly before we go diving. If we had a multiple stent or even bypass graft surgery, bottom line is 6 months, so that the heart muscle which had infarction can regain the normal power. And we have to check through every possible means like EKG, exercise test. And also it is important if he is now able to do all the ordinary life exercise, which means he is ready to dive also. So if we did multiple stents or the bypass surgery, wait like minimum to 6 to 12 months. That's the doctor's recommendation at this point. So we talked about ischemic heart disease, whether we can dive or not. So there's some, to me, there's some philosophical issue in diving. I cannot live without diving. So I dive with hypertension now. I dive with arrhythmia, but I can put them under control. Even with stent, let our doctors decide if we are okay, either to dive or any other exercise. And that was today's issue, diving after coronary artery stent insertion. And thank you very much for attention. I'll see you again.